Welcome everyone. My name is Irfan Ahmed and today we are going to study about the topic that is general pharmacology. So we will continue about the general pharmacology. We are studying about the various sources of drugs which are obtained, which we will study in the pharmacology. So sources of drugs means from where those drugs are obtained. So there are various sources from where the drugs are obtained. Like first is natural drugs. So natural drugs are those drugs which we will obtain either from plants, either from animals or minerals. Okay, plants, animals, we will obtain either these drugs from plants, either from animals, either from minerals, or either from microorganisms. For example, if we obtain drugs from plants, example is digoxin is a drug which is obtained from a plant that's known as Digitalis purpurea. One more example is there atropine. It is a drug which is obtained from Atropa belladonna, that's plant, and quinine, which is an antimalarial drug that's obtained from Cinchona officinalis. And same second one is animals, drugs which are obtained from the animals. For example, insulin. Insulin is a drug that is obtained from pork or beef, okay, which is used in the diabetes. Okay. Second example of the source of drug which is obtained from the animals is cod liver oil. So cod liver oil that's obtained from cod fish liver. And one more is another source which is included in the natural is minerals. For example, iron, which is used as a drug that's obtained from minerals, iodine, potassium salts. So these are the examples of the drugs which are obtained from the minerals. One more is microorganisms. For example, penicillin, that's a drug which is obtained from a microorganism called Penicillium notatum. And same chloramphenicol, it is an antibiotic which is obtained from Streptomyces venezuelae, including a group of actinomycetes. Okay, so these are the various natural sources. These are the various examples of the drugs which are obtained from the nature. For example, we can obtain them from plants or animals or minerals or microorganisms. So these are the various sources of natural drugs. Second source of drugs is synthetic drugs. As the name indicates that synthetic drugs, these are prepared or these are synthesized in pharmaceutical laboratories and by the process of chemical synthesis. So synthetic drugs are those drugs which are prepared by chemical synthesis in pharmaceutical laboratories. For example, sulfonamides is a group of drugs which we synthesize in the pharmaceutical laboratory. Quinolones, barbiturates, these are the examples of the drugs which are synthetic in nature, which we prepare in the pharmaceutical laboratories. Next is third one is semi-synthetic drugs. So semi-synthetic drugs, these are prepared by chemical modification of natural drugs. So these are half synthetic and half natural. Semi-synthetic. Okay, we first of all we obtain them from natural, and then we do some chemical modification to those drugs. So those drugs are called semi-synthetic drugs. Example is ampicillin, which is obtained from penicillin G, and dihydroergotamine, which is obtained from ergotamine. Okay, and the last is biosynthetic drugs. Last source of drugs is biosynthetic drugs, which are prepared by cloning human DNA. Means we put the human DNA into the Escherichia coli, E. coli. Okay, this is a bacteria, and then clone them. For example, human insulin is there, which is called biosynthetic drug, which is called as humulin, or human gonadotropin hormone (GH). This is another example of biosynthetic drug. Now one more thing is there, that is a drug nomenclature, how we name the drugs. Okay. For example, how we name these drugs, drug nomenclature. So any drug that is having three types of names, either chemical name, which is also called as IUPAC, or scientific name. IUPAC means the name which is derived from International Union of Pure and Applied Chemistry, that gives a specific chemical name to a substance, are also called as scientific name. So chemical name, that is based on molecular structure of the drug. What is the structure of the drug? What is the molecular structure of the drug? So that is called as chemical name. So chemical name, that is very long. Often you can see the chemical name of the drug that is also very long. It is a complex, so that we can use it in the common practice. Second is international, or we call it as non-proprietary or generic name. This name is given by Food and Drug Administration or World Health Organization. They approve it, and this is the shorthand version of chemical name. You can say that the international name or the generic name, it is a shorthand version of chemical name, and it is recommended in RX, means it's recommended in prescriptions. You can write down it in prescriptions. One more is that is a property name or trademark or brand name. Brand name is the name which is given by the pharmaceutical company, and this type is very costly. So three types of names are there in drug nomenclature. One is chemical name, or which is called a scientific name, which is based on the molecular structure of the drug, and generic name, it is given by FDA or WHO, which is a shorthand version of the chemical name, and property name or brand name, which is given by the pharmaceutical company which produces that very drug. So example is here, for example, 2-acetoxybenzoic acid. So this is the scientific name of this drug, and aspirin is the generic name is of this drug, and Jasprin is the brand name of the drug. So this is scientific name, this is first one is scientific or chemical name, and second one is generic name, and third one is brand name. Same as this example, ethyl 4,8 chloro 5,6 dihydro 11 H benzo 5,6 cyclohepta 1,2B pyridine 11 yelidine 1 piperidine carboxylate. So this is a long name. So this name is scientific name, but in prescriptions we write it as loratadine, and this is claritin, is it is brand name. Now there are various dosage forms. So what dosage form means? So dosage forms, these are the means by which drug molecules are delivered to the site of action. How means dosage form? These are those means by which we deliver the drug molecules to the sites of action within the body. What is the need of the dosage forms? We need dosage forms because of the accurate dose. We need a protection. For example, coated tablets are there, sealed ampoules are there. We need a protection from gastric juice. We want, if there is a bad odor or bad taste, we need to mask that taste and odor. That's why we need a dosage form. And placement of drugs within the body tissues, that is an important thing, and that's why the dosage forms are produced. This is the important thing. Because of that, the dosage forms are produced. Next thing is what are the various types of the dosage forms? So there are various types of dosage forms which we will discuss according to the route of administration. For example, according to route of administration, if we will see the types of dosage forms, one is oral dosage form, which is given orally, rectal, which is given into the rectum, vaginal, which is given into the vagina in females, parental, which is given into the intravenous route or intramuscular, etc., inhaled, which is directly given in the form of vapors, topical, which is applied topically, ophthalmic, means into the eye, and otic, that's into the optic nerve. So these are the different routes of drug administration. These are the different types of dosage form which are according to the routes of drug administration. So according to the physical form, there are different dosage forms. For example, solid. In solids, there are tablets. One is conventional, another is chewable, one is sublingual, which is placed under the tongue, one is extended release, and second is capsules. These may be either hard gelatin capsules or soft gelatin capsules. Powders, these may be effervescent granules. There may be insufflations, there may be dentifrices used for the cleaning of the teeth, and there may be powder for injections. And in solids, one more is there, suppositories, which are placed in the which have a route of administration is anal. Next is liquid. Liquid dosage form includes solutions, suspensions, emulsions, and one more is there, semi-solids, which includes ointments, creams, pastes, jellies, pizzaris. And fourth type of dosage form according to the physical form, that is gases which are pressurized, for example aerosols. So aerosols, what aerosols are? Aerosols are pressurized dosage forms which is included in the gases. So now according to onset of action, when the action will start, so there are different dosage forms. One is orally, which are swallowed. Second is through, which enter through body through mucous membranes. For example, oral mucosa. Example is sublingual tablets. nasal mucosa example is insufflated. Insufflated means which are inserted into the nose, which enter into the bloodstream through nasal mucosa. And one is topical through skin, and one is rectally, for example suppository. Suppository is a rectal dosage form. So these are the different types of dosage forms according to various onset of action, according to duration of action. So these are the different types of dosage forms which we study. And one more is there parentally, for example injection. Intravenous injection is there. Intramuscular, in intravenous the angle should be 45 degree. Intramuscular injection the angle should be 90 degree. Subcutaneous 15 degree. Intradermal that is also 15 degree. Intraperitoneal IP which is given into the peritoneum. So these are the different parental administrations. One more is there inhaled, in which we inhale through the lungs. Okay, so these are the commonly used routes of drug administration which you can see here, which are the various commonly used routes of drug administration. Parental, it includes IV, IM, SC. Topical you can see here, sublingual you can see here, inhalation you can see, oral, transdermal patches which release the drug over a long period of time. Rectal is there, for example suppositories. So what are the various factors which govern the choice of route? The choice of route depends upon which factors? First, which route we will use, it depends upon the drug characteristics. What are the various characteristics of the drug? What is its chemical nature? What is its solubility, etc. Okay. And second is ease of administration. From which route the drug is easily administrable. So it will also depend upon that. Site of action. What will be the site of action? And one is onset of action, when the action will start, after how much time the action will start when you are taking that very drug. Duration of action, for how long the drug will act. Quantity of drug administered, how much quantity of drug we are giving to a patient. And liver and kidney disease. So these are the various things these are the various factors which govern the choice of a route which we will discuss. What are the which route you are governing, and that route is governed by these very factors which I have discussed here. So this was all for the today's lecture. In next topic we will continue general pharmacology. Thank you.